We're now live.
Hello, I'm Dr. Liz Robin, Director of Public Health for Cambridgeshire and Peterborough, and I'd like to welcome everyone to this first meeting of our local outbreak engagement board. Just to start, I'll take a roll call of everyone who is here. So if people can just unmute and respond when I say your name. So Councillor Hickford, Chair of Cambridgeshire Health and Wellbeing Board.
Present.
Councillor Holditch, Chair of Peterborough Health and Wellbeing Board.
Present, Miss.
Councillor Hudson, Chair of the Health Committee at Cambridgeshire County Council.
Present.
Councillor Fitzgerald, Public Health Portfolio Holder and Deputy Leader at Peterborough. Obviously, I'm here. Wendy Ogle-Wellborn, Executive Director, People and Communities.
Present.
Adrian Chapman, Service Director, Communities and Partnerships.
Present.
Jan Thomas, Accountable Officer, Clinical Commissioning Group.
Yeah.
Then we have Gary Howsam, Clinical Chair, and Louis Kampfer, Chief Finance Officer. They're given apologies.
Liz, we've got Louise Mitchell representing.
Okay, thank you. Louise Mitchell.
Yes, I'm here. Our Director of Strategy and Planning.
Excellent, thank you. Then Councillor Mallion, representing Cambridgeshire District Councils. And Val Moore, Chair of Cambridgeshire and Peterborough Health Watch.
Good morning.
Good morning. And Councillor Ray Bisbee, Acting Police and Crime Commissioner.
Here.
In our membership, we should also include Charlotte Black, Director of Adult Social Care, who is here, I believe.
Yeah, morning, I'm here.
Morning. And we have some officers in attendance. Gillian Beasley, Chief Executive.
Present.
And Christine Birchall, Head of Communications.
Hello, yes, I'm here.
And Kate Parker, Head of Public Health Business Programmes.
Yes, I'm here.
Thank you. And James Veitch from Democratic Services. Excellent. I would now like to call for nominations for the chair of the engagement board today.
Liz, I put my blue hand up, but I'd like to nominate Councillor Roger Hickford.
Thank you. Any seconder, please?
I'll second that, Councillor Holditch.
Okay, so that means that Councillor Hickford is appointed as chair for today's meeting, and I will hand over to Councillor Hickford.
Yeah, thanks, Liz. Usually you're asked if you want to take up the role, but obviously that isn't the case today, so I welcome it. Thank you very much, everyone. So looking at the agenda, we will now go on to apologies and declarations of interest. Obviously, I picked up an apology, I think it was from Wayne, is that correct? But also we have a substitute as well. James, are you picking up on that? Or is someone else picking up the apologies? Okay, in that case, can we note that Councillor Fitzgerald isn't here at the moment? Can you remember anyone else that wasn't present?
The District Council's rep aren't here, Roger.
That's it, Councillor Mallion. Thank you very much. Okay. All right, moving on. Any declarations of interest, anyone? I'm not seeing any hands up, so I'm assuming not. Thank you. So moving on to agenda item 3, which is the terms of reference of Cambridgeshire and Peterborough Local Outbreak Engagement Board. Kate Parker, I believe you're going to introduce this. Is that correct?
Yes, thank you, Chair. Thank you.
Thank you.
So you all have a copy of the draft terms of reference, hopefully in front of you. I'm just going to take you through some key points in the terms of reference, and the opportunity is for this session for you to make any amendments or changes to the terms of reference as we go through this discussion. So the purpose of the Local Engagement Board is part of the governance arrangements that we're putting in place for our local outbreak control. And many of you are aware that we have a multi-agency COVID-19 health protection board, and that's been established across Cambridgeshire and Peterborough. And the board has the responsibility to develop the local outbreak control plans, and we'll be hearing about that a bit later. But the purpose of the local engagement board is to provide that political ownership and the public engagement and reassurance on local outbreak management plans, and also their implementation across Cambridgeshire and Peterborough. We have talked a little bit, because we've just done the introductions and everything, around membership, but I think it's really important that I just talk to you briefly around the membership side of things. We've modelled the membership of the Local Engagement Board on the Health and Wellbeing Board Core Joint Subcommittee, and there are some significant additions to this. So I would just note those additions for you. The additions are the Chair of the Health Committee from Cambridgeshire County Council, the Public Health Portfolio Holder from Peterborough City Council, the Service Director of Communities and Partnerships from both Cambridgeshire and Peterborough Local Authority. And we also have, as we just briefly discussed, representation on behalf of all the districts by Councillor Mallion from South Cambs District Council. And we also have representation from the Police and Crime Commissioner. One of the really important aspects to note in the membership as well is the Local Engagement Board have the ability to call in additional members when required. So an example is provided in the terms of reference around local members to be invited if we are discussing management of a localised outbreak. So that's a really important addition to the membership to note. We've just nominated a chair, but what is missing from the terms of reference is looking at a vice chair. So that is something that I would suggest that we consider in amending to the terms of reference. And moving on to the key features of the board is the responsibilities for the board, and they are on the bottom of page 2, and I'd like to just take you through some of those. So the Local Engagement Board is not a decision-making board, but its aim is to provide public engagement and reassurance to, in regards to the local outbreak control plan and its implementation. So it's got some really key responsibilities, and these are the bits that we really need to consider today as to whether or not you feel there are some amendments required here. So it is to meet in public, and it's meeting as local political leaders to provide that appropriate transparency and communication about COVID-19 and the local outbreak control plan. Really important part of this meeting is to look at including prevention and early detection and management of outbreaks in the discussions. It's also to update the public on the latest local trends, issues and operational decisions taken by the COVID-19 management plans. And it's to provide political leadership to support the required outbreak management actions. So, for example, if there was ever a case that we were looking at local lockdowns or closures. Really important is the opportunity to provide the public an ability to ask us questions. So that's been built into the responsibilities. And then it's there also to provide community leadership by reinforcing key messages, key public health messages around hygiene, social distancing, and other measures that will help prevent the spread of COVID-19 in our communities. And then the last aspect that we've put into the terms of reference is that political leadership and wider engagement to support the implementation of the local outbreak plan. And that's engagement with our districts, our city councils, our parish councils, the combined authority, but really important, it's the community groups and the voluntary sector as well that we really need this board to work with. So I've summarised for you the key aspects of the terms of reference, and we have also discussed at the beginning about the inclusion of the Director of Adult Services. So I've noted that as an included into the terms of reference. We would like to probably build in the vice chairmanship in the terms of reference as well, but as an opportunity for you to comment and for me to note and make changes to the terms of reference as they stand. So back to you, Chair.
Thank you, Kate. Yes, and it seems quite comprehensive. I'll open it up to other members in a minute. Just say about the vice chairs, obviously it is quite important to do that, especially as we're in a virtual world and we don't know how technology is all the time, and if something happens to the chair, then the meeting needs to go on. So that'd be a good idea to include that. John Holditch, you've got your hand up. John, you're on mute.
Has it come off?
Yeah, we can hear you now.
Okay. Some people prefer it that way, you know. I wanted to talk about local membership in the event of a local outbreak. When I was discussing it with Liz, it seemed to me that it'd be the leader of the local council, but I think we agreed, and I'm sure that we did agree, that it would go down to ward councillors. In which case you need to define that, because if it was in Peterborough, in a particular area that we're probably concerned about, you would have 12 councillors. And I think it probably needs to be no more than, again, we've got 3 councillors in each ward. I think it needs to be only one from each affected ward, rather than getting 12 together. I don't know how you can get that in. You've got to make it so that it does go down to the community, but I don't think you need 12 councillors involved in a particular area. Now, I propose that we had one from each ward if necessary.
Okay, John. Thank you for that. I think that's a good point. When it's a big outbreak, then obviously leaders will obviously step in, I think. But if it's localised but fairly big and involves more than one ward or division for Cambridgeshire, I think that's a good point. So, Liz, is there an easy answer, as John suggested now, or is it something that we need to take away and just bring back to the next meeting once we've thought about it?
I think there is, we need an element of flexibility, and I discussed this with Councillor Holditch, in that Cambridgeshire is a 2-tier system and Peterborough is a unitary. So if you had an outbreak in one ward, that might be quite simple. The local member might be fairly obvious. It might be perhaps one or 2 or 3 members. But if you had an outbreak that covered perhaps 3 wards, then you start getting into quite large numbers. And in Peterborough, I think we talked about perhaps you could have 1 councillor from each ward, and that would be a reasonable number. If it was, say, in Cambridge City, you might look at doing that, but you might also have the leader of Cambridge City who would be interested, because in a 2-tier area, we don't have that representation from the city council, and that would be similar for Fenland or Huntingdonshire or any other district. So I think in Cambridgeshire we may have to factor in the 2nd-tier element a bit more, where there's an outbreak across multiple wards, because they might want the leader of the council or deputy leader to do it, whereas of the district council. Whereas in Peterborough, with 1 tier, it would have to be ward-based. So that's to feed back really the discussions that we've had, whether we need some flexibility, recognising that one area is a 2-tier and one area is a unitary.
I think we need to look at this properly, because I can just see, I know what you're saying about Peterborough, but if you take Cambridgeshire, you've got the county council divisions for the county councillors, and then you've got the wards for the district council. And that sometimes some divisions will have lots of district councillors, and I can just see that they would all want to have a say in something, especially if they were different political parties. You want to make sure that obviously there's representation. So can I suggest that we take this away and work it up, because I don't think there's an easy answer right this moment in time, and we'll bring it back as an amendment next time to the terms of reference. I think that would be sensible. John, would you be okay with that, John?
Yeah, I think we do need to address it, because it does need to go down to a local level. I don't think it should be left to leaders. Yeah.
No, absolutely. Okay, so we need to work that up a little bit more in the terms of reference and bring them back next time. Peter Hudson.
Thank you, Chair. Two things. I absolutely agree. We need to change the terms of reference and have a vice chair, which I believe should be John. So when the time comes to do that, I'll gladly propose John Holditch as the vice chair for this committee. Also, going on, you're talking about district councillors and wards and divisions. I mean, yeah, Peterborough is a case which John has a plan of, I'm sure he could work out. But every ward, every parish within the county of Cambridgeshire has a county councillor representing them. I have 3 or 4 parishes, and there's an enormous amount of district councillors everywhere, and that's just too many. Cambridge City also has county councillors representing all areas of Cambridge City. So the local member should be a county councillor of that area, I really believe. And every area within the county and Cambridge City has a county councillor representing them. I don't think it has to go to local leaders or too many other local elected members, because it will be swamped, it will be a bureaucratic nightmare, there'll be differences of opinion, and that's not what this board is all about. Thank you.
Thank you, Peter. Just picking up on that last point, I think it is important to work this up, and whether it is just county councillors or it's a mixture, so we really need to look at this and see what's the most efficient and effective way of doing this, with being as inclusive as possible. Obviously, so thank you for that, and obviously we're going to bring that back next time. With regards to
can I come back, Roger?
Sorry,
can I just come back on that point just quickly? It's important we don't get into political arguments, because this is above politics. It's beyond politics. This is about people's health. It's about people's safety. And it's about our responsibility for the public health of the county of Cambridgeshire and Peterborough City Council. So politics should be given the boot out the window, and we should think of that while we make these arrangements.
No, absolutely agree, Peter, and that's why I want a kind of a simplistic, if you like, roadmap to say who should be doing it, but still with flexibility to be as inclusive as possible. So we'll come back with that. With regards to the vice chair, if I can just say, I think what we're looking to do is alternate the chairs and vice chairs between myself and John. And obviously, if there is an outbreak in a specific area, then you know, John will do Peterborough and I'll do Cambridgeshire. So I think that's how we'll go forward. But thank you for that. I haven't. Liz, yes, please come back.
Yes, it's just to say really that the terms of reference outline the role of this board in communicating and engaging with the public, and that's why Christine is in attendance, because the communications element is so important. But we've touched on the role of local members as something that we need to take away and work up. But I'd also just like to propose that it may be beneficial to get together in an informal workshop from the board to really think down into those terms of reference and how we want to do some of this engagement and communications work, as well as some of the more formal elements, such as the role of local members. So just to put that forward as a proposition.
I'm very happy with that, Liz, but we need to do it sooner rather than later. I don't want this hanging around, and I know we've had to do everything quickly here, but we still need to do things quickly and to get it right as possible. So I'm very happy to have a workshop, work it up, and as long as it's ready for the next board, that'll be good.
Brilliant. Thank you.
All right, thank you. Peter, do you want to come back, or is your hand raised from
Yeah, just really quickly, I'm sorry, to go off forward on Liz's. I would really like, please, when we work this out for elected member representation, if there are any outbreaks, I think we should all work that out between in consultation with obviously yourself and John, but also the other elected members on this board should work together to come up with a plan we can all work with.
Okay, thank you, Peter. I haven't got anyone else that wishes to speak on this, so can I, although there's nothing officially on the agenda about agreeing the terms of reference, they're just there. We obviously have some amendments to do and bring back for next time, with possibly a workshop in between, definitely a workshop in between. And we've also suggested things that should be added anyway, such as vice chairs, etc. So can I just have agreement from everyone that terms of reference are as at the moment, but they are going to come back with some amendments for the next board meeting as well, if that's okay, so that we do have something in place at the moment. Is everyone okay with that? Just nods would be fine. If anyone disagrees, please raise your hand. And Liz, you're the only one disagreeing, because I think you left your blue hand up from last time. Right, smashing. Okay, thank you. So that's the terms of reference. Just moving on to the next item on the agenda, which is the Cambridgeshire and Peterborough local outbreak plan. Liz, are you going to introduce? I think you can do a quick introduction and then pass it on to others. Is that correct?
Yes, I will introduce quickly. So this is the first meeting in public which the final version of our local outbreak control plan has been brought to. As you all know, we have been spending some time working on creating a local plan, which means that we can effectively prevent, identify and manage outbreaks in local settings and in the local area. And this work has been very practical. It has been about identifying what needs to be in place in order to achieve that. So what we will do for prevention, what we will do to make sure there's really easy access to testing, how we will communicate the workforce that's needed, and how we will address outbreaks, how we will conduct surveillance so that we're to look at the data in real time, and how we will manage outbreaks in different settings such as care homes, schools or workplaces. So there's been a lot of very practical work done by officers to get that into place and make sure that we have planned what we need in order to achieve this. And that's very important because this responsibility is coming over much more to us at local level. That work did end up with rather a long and rather technical and rather repetitive document that was not very public friendly. And Christine, Gillian, Sue Grace and others did and worked with the public health teams to do an absolutely brilliant job of turning that work into a good, understandable public facing document, which was published on the 30th of June. And which you have the link to in your papers. Before it was published, the day before, and many of you were here, we met as a joint whole system Health and Wellbeing Board subcommittee with the full membership of both boards, and there were some excellent comments back from board members about the importance of community engagement, community groups, the role of the district councils, the work that Adrian Chapman has been doing around engaging at a district level and a local level, and that the work that had been done to support vulnerable people, shielded people in the earlier response phase of this pandemic, those groups absolutely needed to continue to be engaged in the local outbreak control plan. So that plan was changed quite significantly in response to that feedback and really strengthened in terms of those elements. That Health and Wellbeing Board input made a real difference. And that resulted in the plan that was published on June the 30th. So I would like to thank the wider Health and Wellbeing Board for that. We're now very focused on implementation of the plan, and we'll cover some more of that in the report back from the Health Protection Board. So again, very much a team effort with close involvement from Gillian and from wider members of the team, a lot of involvement from Christine as well. We are working very hard on the implementation of this plan and already have very important parts of it up and running, but also planning for potentially higher levels of need. I'll stop there and ask firstly Gillian and then Christine what you would like to add, because this, as I say, this is an absolute team effort.
Chairman, if it's okay through you, what I would say really is we've kind of entered a new world of local outbreak control plans and language and acronyms that perhaps aren't as familiar as others that we've been used to working within. And we've got a prevention strand, we've got outbreak management teams, IMTs, rapid response, a legislative framework that we have to work within, the connection of this board, the engagement board with community, etc. And my experience tells me that when you're in a system such as this, and where you do have to work at pace, which the chairman has made us clear about, we all need to know how that system works together, because there's various components of it, because you can't work within it unless you know what other parts of it are doing. And that's why I'm really pleased to hear Liz recommending and Chairman you agreeing that we should have a workshop, because functioning in a system such as this could be very difficult if you can't understand how it works and how the flows of decision making work, and your own role and accountability is understood within that. So from my perspective, we've got a good plan. It's good to see it's public facing, but it probably is still a bit puzzling to people and not completely understood. And for this particular board to be as effective as it needs to be, and I think it's critical, the role of this board, we need to have that workshop where we all understand as as professionals, but also as members, the community, and all those components coming together so that we are effective in Cambridgeshire and Peterborough, not only in prevention, because that's probably where we want to put a lot of our effort, but when we get an outbreak, being absolutely on top of, acting with pace, with understanding, and decisively to make sure that we do well for protecting our residents. So I just wanted to underline, I think, the importance of us meeting and coming together in that way as we need to, and really bringing that plan to life for our area and for our citizens. So that's my comments on the matter. Thank you.
Thanks, Gillian. Who else was going to come in, Liz? Oh, Christine, it was you, wasn't it? Hi.
Yes, hello. So just to reiterate that obviously it was done at pace, and we did have the task of trying to make this as public facing as possible. We built on the very public facing test and trace document that we'd published, I think, a fortnight or so before. And we did engage the whole of the strategic coordinating group. We did work with the Warn and Inform communications lead. We also worked with the Health and Wellbeing Board, and we took on board all of those comments where we could. But as both Liz and Gillian has said, we've worked at pace and we need to make this really understandable. And there are elements of the prevention strand which are already up and running. You've all been supporting this week the launch of the Cambridgeshire and Peterborough Keep Caring campaign, which is the first strand of the prevention work that we're doing. So thank you very much for that. And there will be a whole schedule of that which will be coming out, which is being developed again across the whole Warn and Inform communications cell. But I also commend the idea of a workshop, because I think that will be very useful.
Thanks, Christine. And just before I open it up again, I know it's been said before, and I'm sure it'll be said again, but thank you to everyone who produced this document. I think it's a really splendid document. So I know a lot of work went into it, and a lot of speed went into it as well. And to come out with something that's good and robust at the end of it is really good work. So thank you again. And just before I open it up, just to acknowledge Councillor Wayne Fitzgerald, welcome. We gave you apologies at the beginning, but just to acknowledge you're here now, so thank you. Okay, so
I had sorry, Roger. I had trouble finding the. I was 5 minutes late, and then I couldn't find the link. So I only missed the first few minutes. So I've been here a while, but I've just been silent, which is unusual for me.
Yes. Be quiet. Charlotte, you want to speak?
Yes, just briefly. Thank you, Chair. I just wanted to make a link really to the work that we've been doing on reducing infection in care homes. So we've got a really good, I think, care home support plan, which we've developed across health and social care. And it might be helpful to think about how in that workshop we could give a bit of feedback about that work, how that's progressing, and some of the challenges and opportunities that are in front of us. But I think we've made really good progress, but that's obviously going to be a key success criteria going forwards.
Thanks, Charlotte. This workshop keeps coming up, and it's a matter of urgency, and I'm assuming we're going to need at least a couple of hours, if not more, on this. So Liz, can you take this away? And I know everyone's diary is already full, but we're going to have to try and find something somewhere and give people as much notice to shift things around so they can attend.
Absolutely. Yes, Chair.
Thank you. Okay. So I haven't got anyone else that wishes to speak. Does anyone else wish to pick up on this at all? Okay. Well, it doesn't require any decision. It's there. It's the first time it's been public facing, I think, in a meeting. So that's good. It's out there now. So moving on to the next item on the agenda, which is the Cambridgeshire and Peterborough Health Protection Board. And Liz, you're taking this one because you're chair as well, aren't you?
Yes, that's correct. Yeah.
Thank you.
Thank you. So as part of the requirement, the national requirement to produce local outbreak control plans for each upper tier local authority, there was also a requirement to set up a health protection board to oversee this work. And this board has been meeting for some time. We set it up at the end of May because we felt the board very much had a role in bringing people together to produce the local outbreak control plan, as well as a role in implementation. So it meets weekly on a Thursday, and has representation from the councils, from district environmental health, from the clinical commissioning group, their lead nurse who has responsibility for infection control at the CCG, and also their head of information. And it has representation from Public Health England. So it's a board where we can look strategically at the trends that are happening in COVID-19, what's happening to the epidemiology. So we are not just looking at the here and now. We receive a surveillance report, but we're also looking ahead and thinking, what do we need to plan for in terms of COVID-19? So it's trends, but also the other things which are happening in society. And as well as that, the board oversees the arrangements for that we have now for responding to outbreaks and cases. So, and that enables that multi-agency discussion, because we are responsible as a system, not just as a council. And that's very important. So this report just gives you some details of the work to date. Clearly, the first piece of work was producing the local outbreak control plan. Next is the review of epidemiology and trends. And just to explain what we're doing at the moment, we have a surveillance cell which sits under the Health Protection Board. It's chaired by the Deputy Director of Public Health for Peterborough, and it has input from the Head of Business Information for Cambridgeshire County Council and Peterborough City Council, and also from the Head of Intelligence at the CCG, and from Local Authority Public Health. So it brings together senior information specialists, and on a daily basis, they review several sources of data and information, both on the factors which may affect COVID-19 risk, such as the use of public transport, travel figures, etc. The information that we get in from our local hospitals and healthcare system, and information that we receive from Public Health England regionally and nationally, and from the National Test and Trace system. So we have a large number of different data flows coming in daily now, and the surveillance cell reviews those. And it meets at 9 o'clock. That group then puts together the day's overview, and that feeds into the local outbreak management team, which meets every day at 10:30. And the local outbreak management team receives the surveillance position, the summary of what the data is showing, but it also has a single point of contact, email and phone. So it also receives other information, including more detailed reports of cases in settings that we might need to manage locally, such as care homes, as Charlotte said, or schools and early years centres, or workplaces where we know that there is a case in a workplace setting, or two cases in a workplace setting, and also cases which occur amongst vulnerable groups in the population that we know are at higher risk, and potentially at higher risk of spread. So we get detail where those cases have been reported to Public Health England. We get the detailed risk assessments through from Public Health England of that setting, which will have been worked up through our regional Public Health England Health Protection team, talking directly to the managers of the settings and going through their risk assessment. We receive the output of that into our single point of contact, and we then follow that up locally through agreed operating procedures, which we share with Public Health England. We agree how we operate across the organisations. And depending on the setting, that might be follow-up of a workplace setting by going through our district environmental health officers. So we have environmental health officer representation on that team. If it's in a school, we have standard operating procedures of how our education department links with the school and what the school needs to do. And if it's in a care home, it will go to our care home cell, which involves adult social care, but also CCG infection control nurses. So we have arrangements set up for that outbreak management team to record everything that comes in, to maintain a log of cases and incidents so that we have all recording, but also to oversee the day-to-day management of what is happening. And at the moment we are what we call level 1, which is that there are cases there, and the definition, outbreaks can sound quite scary, but an outbreak can just be one suspected case in a care home, not even a confirmed case. Just someone with symptoms in a care home would meet the definition of an outbreak for Public Health England, and would result in that information coming through to us. So there's a lot of quite low level cases or incidents coming through to this central point, which then has that oversight, make sure that things are recorded and the right things are done and followed up. So that's actually very active at the moment. And a recent example, which people will be aware of, is an outbreak in the Prince's factory in Wisbech. We didn't actually have this full system when that first started, and we've used learning from that to help make sure that our system is effective. But that outbreak has been effectively managed and controlled by that through that multi-agency working. And a very collaborative work with the factory and the workplace in implementing all the right measures. We have some of those basics in place, and we are moving on now with absolutely making sure we have the right end-to-end operating model across the whole system, which factors in the importance of prevention, of the local community response, very much working with Adrian's and the district councils and community sector on local responses in each area, how that works, working with a communications team, and also, and particularly important, planning for the potential for an increase in cases and outbreaks. So at the moment, I said we're at level 1, but a key part of our planning is to know what capacity and processes we need when we move to level 2 or level 3. So what we're doing is we're functioning now, but we are building the capacity, the training, the workforce, the detailed plans for a potential move to a higher level of cases as time goes on, so that we absolutely have those plans in place and are confident in them. We have a finance subgroup which has already met and allocated a significant proportion of the test and trace grant, because this is work that needs to be done now and not delayed. We have also reviewed a number of assurance mechanisms. So we conducted a self-assessment against a regional and national assurance framework. We looked at the best practice shared by Tom Reardon, the local authority lead for the National Test and Trace programme, and we looked at the key principles for outbreak management agreed by Association of Directors of Public Health, the Local Government Association, and Chief Environmental Health Officers Group, amongst others. And that shows the areas we particularly need to work on are the further development of our prevention and community engagement activity, data sharing with key partners with information governance in place, training, enhancing our core workforce, and ensuring that our high risk settings are proactively identified and contactable across the county. So all of that will be overseen by the Health Protection Board, but also by an implementation program implementation board that sits under the Health Protection Board, and we're just planning our battle rhythm, as we call it, around the Health Protection Board meeting, then the local implementation board meeting. And I'm pleased to say that we have a senior district officer who is going to chair the implementation board, so genuinely multi-agency, because the role of districts is extremely important in this. Prevention is a key part of the plan, and as I've said, and some of what we're doing at the moment is developing that prevention further. Further to that, I will just say, because it is in the media at the moment, that we have previously seen, when we moved to monitoring pillar 2 cases in Peterborough, which are from tests run by the national laboratories, the drive-in, the self-ordered tests for members of the public, and the care home screening. Peterborough has a much higher level relative to others on pillar 2 tests than it does on pillar 1, which are people who actually go to hospital or are in an outbreak in a care home. And it is in the media today that Peterborough actually is in 10th position nationally in terms of cases in the previous week. Sorry, my voice is going hoarse. I've been talking for too long, Councillor Higford. I would like to reassure people that the number of cases in Peterborough is consistently coming down. The trend in Peterborough is absolutely going in the right direction. And it is way below, because I know people sometimes make the comparison, the levels in Leicester, which are about 10 times higher. So we are on that downward trend. We have, I can quote the numbers if anyone wants. What's happened is that everyone is on a downward trend, all local authorities, and our position has just shifted very slightly in Peterborough from being 13th in the country to being 10th. What that means, of course, is if you're in the top 10, that then stimulates a lot of media activity. So I just want to reassure people we're not in the top 10 because numbers are going up. Our numbers are going down, but we've just had a slight statistical shift. Having said that, we do have COVID-19 community transmission in all areas of Cambridgeshire and Peterborough. This virus has not gone away. And the main thing that will prevent the virus spreading is people absolutely following the preventive public health messages. The work that we do in the outbreak control team and the wider system will help, but the responsibility and the key actions lie with our residents. So it is absolutely critical that people listen to and see that we still have cases in our communities. There are still risks of community transmission, that the public, and it's not that we want society to shut down, society needs to get going again, but maintaining the 2-metre social distancing whenever possible, putting in place mitigations if that needs to go down to 1 metre, such as face coverings, screens, and other measures. Good hand hygiene, as we've been saying from the beginning, makes a huge amount of difference. We know there's transmission through people's touching things through their hands, then touching their face. Getting a test if you have any of the symptoms of COVID-19 and self-isolating with your household from that point, and self-isolating for 14 days if you are told that you're a close contact of a case. All of those preventive measures which every resident needs to take are absolutely essential. I'm always in a way quite glad when we get media publicity, because it does just help to reinforce those key messages. So I'll finish there, and thank you for allowing me that length of time, Councillor Hickford.
No, you're welcome, Liz, and thank you for that, and thank you for the explanation on Peterborough as well. I think that was very clear. Can I just pick you up on one thing? In the papers today on 2.5, it says the main focus of the Health Protection Board is now on implementation of the local outbreak control plan, and I fully understand that. But whenever I speak with members and officers, we always emphasise how much we want to look at prevention. And part of prevention is the data that we receive. And I'm not going to say, do we receive enough data, because we never receive enough data probably for this. But is there any major holes in the data that we're receiving, or time lags that we recognise and could do something about, or recognise and can't do anything about at the moment?
We have a gap at the moment, which is that we receive postcode level data for cases anonymised. So we can really see where cases are occurring in our areas, but that's only weekly at the moment. We are likely to enter a pilot shortly as a pilot area for daily postcode information. So that's a positive move forward. The big gap that we are worried about at the moment, or not worried, but that we would like improvement on, is more direct access to some of the data from those central test and trace and Public Health England systems that links our cases to specific settings or outbreaks. So at the moment, we will be able to see how many cases we've got, what area of Cambridgeshire or Peterborough that they're in, but we can't directly say that case was, for instance, associated with a particular factory outbreak. We can deduce that by knowing the number of cases in the factory outbreak and the number of cases in the area and saying they're about the same. But we're making deductions all the time. And what we would like would be to get that information that was directly linked into what we could call the CTAS system and other systems. So I'm actually preparing a briefing for councillors on this and on the very specific things that would really help us. The postcode data has helped hugely. Things are far better than they were a month ago, but there still is another level that we could go to so that we know, rather than having to deduce the links between settings and cases, postcoded cases.
And just a quick one, you mentioned the pilot to have daily data. How soon might that come in?
I'm happy to get back to you on that, Councillor Hickford. My understanding is it is due to start very soon.
Excellent, okay. I've got Val Moore.
Thank you. I've just got a couple of questions. One is about the information coming from the surveillance cell, which is clearly fundamental, and I'm interested in the board's view about what extent that can be shared, some aspect of it, some dashboard maybe that is beneficial for the public to track and understand these issues on a, not daily maybe, but a weekly basis, because I think and I'm not a fan of complete openness about all the data, because I know how dense it is, and I know the modelling, as you say, comes with assumptions and with caveats around it that wouldn't be appropriate, as well as very local information that could identify people. So I completely understand why it might not be a good thing, but might the board consider what, on a daily routine basis, let's hope, as we continue to go down, information can inform the public around what we know about our area. And then secondly, just a question about the outbreak at Prince's in Wisbech. If that's the only time that the public hear a flurry of activity, or that we've reached the top 10 in Peterborough or whatever, then I think the power of communications is lessened really for the whole population in terms of what's going on and what the situation is. And I wondered what learning there was from the Prince's experience about good communication with that locality or more broadly, and what we can learn from that. So two parts, one about the surveillance information and another about the learning from the communications recently.
Thank you, Val, and those are both very, very good questions, and others may want to come in around that. A lot of the information that we get through in the surveillance cell, particularly the daily information, is confidential, and some of that would be because it relates to individual cases, but also it's because it tends to change. So it's not that neat. So you'll have a certain number of cases in a day, and then a couple of days later another result will come in and that result will change. So a lot of the information we get in does actually change a bit, and it tends not to be published in the public domain until everyone's confident that the final number of cases has come through. So there's a bit about accuracy, there's a bit about complexity, but I do absolutely agree with you that we need to get this right, and that's very much a role of this board. And Christine and Gillian and others may want to come in, is about how we get that public communication and engagement right. So I would say that that's something that we need to be working through as a board. It might be something that we want to talk about at a workshop. It's where can we go with getting the right information through and engaging with our local community and our local areas, because as I've said earlier, it's the public that will make the difference to how this goes. So we need to be communicating really well in a way that people can understand, and we need to be doing whatever we can with the data that we get, while recognising the information governance and confidentiality issues as well. So that's one thing. I think we've had lots of learning from Prince's outbreak. I think actually they're a very responsible company, worked very well with the system, and all the right measures put in place and brought under control. So in that sense, it's very positive. I think what we learned from it was about some of the information flows between different parts of the system, and that includes the communications that went out in the public domain. And we have used the learning from that about where information comes into the system, who knows what when, to help to structure the processes that we have now, to make sure that we are on the front foot. And one of the things we really want to develop in our surveillance cell is not just getting the data going up to test and trace through people being tested, that going up nationally, then coming back down again regionally, then coming to us. We want as much as possible to be getting that local intelligence in, so that when the factory knows they've got cases, they know how to get that information to our surveillance cells. So we're really working hard on trying to develop those information flows, which would have been very helpful, I think. It's doing that learning has been very important.
Thanks, Liz. Val, is that okay?
Yes, that's interesting. It was the public-facing communications that was the angle I was coming from, with the Health Watch sort of mindset on it. But I can see, the learning will accelerate, and I'm really keen to have those conversations about what the public would want or need, and and what's appropriate. And I don't think they would say I want everything, because of the reasons that you've said. So look forward to those conversations when at the workshop or wherever.
Thank you. But I was going to pick up on that. And Christine, if I could bring you in at the moment, because Liz was suggesting we wait till a workshop to discuss it. But, there's obviously something in place at the moment. Can you just reassure us what there is and what we do maybe need to discuss, or maybe you haven't got it in your head yet what we need to discuss at a workshop, but certainly what's in place at the moment?
Yes, so we're working quite hard on making sure that we're getting the information to the right places for action. So as Liz is pointing out, quite a lot of the daily information is stuff we're learning about, but we don't know enough about whether or not it is something, or if it's just sort of indication. So that would tend to worry, but not actually be able to do anything. But we are looking at a really good weekly briefing that needs to come out. We're also looking at the process for who needs to know and when, and getting that much better defined amongst all of the democratic leadership, but also other people in the communities. We are also looking at how we really mobilise local communities, and we've been talking to Adrian and the Community Reference Group about how we can mobilise all of that really good community effort that we've had, and the volunteers who've come forward who still want to be part of helping us fight this awful pandemic, and how we can really utilise those people when we've got that postcode data on a daily basis, and we would be able to say and mobilise people who live in those areas, and community representatives and ward members to say, right, there's something building up here, here's the information, this is where we need you to be getting these messages out, doing this sort of action. So that's absolutely on our radar. We're doing it in a bit. So Prince's isn't the only thing. We've obviously had things like the Peterborough market. There's been lots of work that's gone on around that. We've done the rapid response work, which has happened around the postcode areas we were identifying in Peterborough. And again, lots of very dedicated and focused communications with the communities, with the help of ward members, with the help of group leaders. So that happens when there's an outbreak, and then there's the more regular stuff. But we are absolutely looking at how we can get that information in a really sensible, usable way to people so that they can do something with it.
Thank you. And Adrian, because I haven't brought you in yet, welcome. Obviously, the community effort has been outstanding, and the volunteers, etc., and the coordination from yourself and the officers has been exemplary. So, thank you for that. How is the goodwill in the community out there at the moment?
Thank you, Chairman. That's generous of you. And yeah, I've been blown away. I think we all have, by the community response. So very localised voluntary action with no ask on our part, right through to very formal structures that will live on, I think, way beyond recovery. And that's our intention, is to try and harness all of this great capacity that's been self-finding. It's something we want to keep hold of going forwards. I would say, I mean, the response to the work that we're now looking to do, and for me, unsurprisingly, prevention is the art of the game here. We really want to be on the front foot, front and centre, understanding the surveillance information, but being proactive about getting out there and before we get an outbreak, to stop an outbreak. I would say the response that we've had so far, when we've been talking to community leaders, parish councils, district colleagues and others, has been equally exemplary. We've got community representatives who are translating material for us, who are reaching out to their own particular groups or neighbourhoods or communities. And it feels like the kind of spirit that we created through the response phase really does feel like it's here to continue. We've surveyed our volunteers, of 2,500 of them that stood up behind us or alongside us during the recovery phase, and 60% of those want to continue to work with us going forwards. Half of those 60% have got a valid DBS check. So we're talking about people who, can be really significant in our preventative effort by working on the ground with friends, neighbours, communities to understand the data, yes, but also make sure that we're feeding that intelligence back through the system. So the fewer outbreaks we actually get, the better through a strong preventative approach. That's our drive. Thank you, Adrian. Thank you. It's all good news. Thank you for that. I've got no one that wishes to speak, but I'm going to throw something out there that came up at a county group meeting, was about prevention on this. And what we see in lots of other parts of the world is the thermometers being used all the time. Everywhere you go, whether you want to go in a shop or a pub or anything, your temperature's being taken. Is this something that we can look at locally? And, is there enough thermometers in the world to go around? I have absolutely no idea how effective it is, or if it is effective, if it's something that we could actually lead on in a prevention sense. Have you any ideas on that at all, Liz?
On the whole, I wouldn't strongly recommend it, to be honest, Councillor Hickford. I think it's a really interesting question and we absolutely need to explore it, because there have been other examples where we've seen other parts of the world doing things and we've said initially we don't think there's much evidence for this, and then we've moved on into saying, well, actually, yes, as with face coverings on public transport and other things, everyone is learning as they go. So I think it is a really good question. The current state of play is that not everybody gets a temperature if they've got COVID. So there are some concerns that it could offer some false reassurance and may not actually. There's some things that we are very confident work. The hand washing and the social distancing, we absolutely know work. We've had that from the beginning. There are other things like face coverings where the evidence is built up over time. I would say with the temperature taking at the moment, we're not in that position where the evidence has built up, because it is quite patchy as to who gets the temperature, who doesn't, how it relates to their infectivity. So just a bit of a risk that people are reassured that someone hasn't got a temperature, they're okay, and actually they're not okay at all. So that's where that debate is at the moment in the sort of scientific community, is my understanding. But
I understand, but obviously if someone hasn't got a temperature, you're no worse off if you take their temperature and they haven't got one but they have got COVID. But if they have got a temperature, then obviously it's a warning sign. And I think the message is, if you feel unwell, you're not going to get into a pub anyway, and you should be staying at home and getting yourself better. But maybe it's something we can bring up at the workshop, because I do think it's something that we should explore a little bit more, maybe. Yeah. But I've got no one else that wishes to speak. I do know that we have a recommendation on this particular bit of the paper, which is to notes and comments on the work of the Health Protection Board and progress made to date, which we have done, and I can see some nods, so that's great, thank you. So we have nothing else today, and we're just about on time, so we have no public questions today. So on that basis, I'll bring the meeting to a close by thanking everyone for their time, and we'll see you at a workshop soon. Thank you.